Hi, my name is Syed, and I'm one of the orthopedic doctors. Regarding you are going for a total hip replacement surgery, I want to discuss something with regarding your surgical intervention. So today you are going for right total hip replacement surgery under Mr. Dash. The aim of this surgery is to relieve the pain and improve your discomfort. Our first aim is to improve your symptoms, and our secondary aim is to improve the quality of life with good functional results. The problem with this is that this is a high risk surgery. There are If we do nothing with this, you will continue with the painkillers, and I know that you are on the top of the notch with respect to painkillers already. The problem is that you need to be committed for this surgical intervention. We will go to the anesthesia will see, and doctor will see you and decide what type of anesthesia which will be given to you. Regarding the surgery, it improves the functions and as well, but our primary aim is to improve the pain. The risk which happens with the surgical intervention is bleeding, which needs transfusion sometimes, infection, which can happen and might need surgery or maybe revision. A blood clot can happen in the calf or the lung. The calf is treated with a short duration of medication, but the lung is life-threatening, and the risk of that is 0.1% if it is fatal. 1% in 1% of the cases, we see pulmonary embolism. Cardiac problems can happen. Loosening can happen, which is called aseptic loosening. The implant loosens up, and then you are symptomatic with similar pain, and you need to revise. Nerve injury can happen. Sciatic nerve is nearby. It's important structure which can get injured. Dislocation can happen, which is a risk. Vascular injuries can happen, which needs sometimes surgery. A fracture can happen in the area which needs a specialized sort of care and operative intervention. Sometimes there is a trochanteric bursitis which can happen. Limb length, we want to keep it the limb length optimal, but sometimes our surgical intervention, sometimes there is some shortening. And for or lengthening, and for that you sometimes need support, need orthotic referrals. Sometimes there is osteophytic or atrophic ossification. There is bone formation inside the muscle, which sometimes is symptomatic in 5% of the patients. Moreover, 1 in 10 patients are not happy with our surgical intervention, even if the results are optimal as but what we need. So therefore, if that's okay with you, can you proceed? Would you like to proceed with the surgical intervention and sign over here?